I'm Dr. Rajkumar. I'm the head of the intensive care unit in Mehta's Velpanjavadi. For the past 2 months, we are looking care of COVID patients. Quite tough time for every one of us here. The current problems compared to the normal times, the volume of the patient is quite high. Whoever comes to ICU, they stay for a prolonged time, 10 days or a 2 weeks time they are staying with us. Duration of exposure, we healthcare workers face is quite high. How to protect our healthcare workers from infection, the contamination and transmission of infection we should protect. That is also problematic. At that point of time, we need some time to isolation or some rest. When doctors go out of rest, the volume of the doctors who will be available for treating the patients will also be less. If I stay inside the ICU, staying with the PPE is very difficult. Highly contagious disease, we can't go and touch the patient and measure the BP and other vital parameters each and every time. With the Health Sensei app, I can just see the vitals of the patient, just coordinate with the staffs. If there is any derangement in the vitals, I can just guide them through phone. It's definitely helpful. Minimize the unnecessary exposure to positive patients and thereby preventing cross-contamination. Avoid unnecessary visit to the bedside for latest vital data. Increases the capacity of healthcare workers without compromising the patient's safety. In person, I can sit at a place and just monitor the vitals of all my patients. No need to go inside the ICU, get myself exposed. When I'm in my home, before going to bed, I just check the vitals, check the trends. The patient is having a persistent rise in the heart rate over the day, just a gradual trend I can see. With that, I can plan the investigations for the next day and also helps in guiding my doctors. In ICU, monitoring is very important. Minute by minute, we monitor the vitals. We just give some interventions and we just monitor the patient, how the patient responds to the intervention, how the heart rate is changed over the time, how the BP is over the time. Those things, it helps in making a clinical decision. In a routine practice, we have a flow sheet in which we enter all the patient's vitals every hour. The patient is going to stay in ICU for 10 days. We have a bunch of papers. With this digital data, just we are going through a paperless documentation of all the things. That is definitely helpful. The app is it's really user-friendly. Being a monitoring app, I can get all the important vital data of my patient. Most of the hospitals which are treating COVID can implement Health Sensei. With this app, I feel even I'm off duty, I can feel that I'm staying with the patient.